The nice thing about it is you can customize to each patient. We all have some facial asymmetries. One of our cheek bones might be a little more receded than the other. So we can play around with that to really customize the fat grafting to each patient. And the other thing is that we can also process the fat differently, even within the face. So when I inject fat on the mid-face area or deeper areas, I process it slightly different than when I do it for the lower eyelid, where there's less soft tissue coverage and your skin is thinner. So you want that fat to be a little more processed, and I do what's called nanofat there, which is
that's
processing it a little
me.
more.
Yeah. So go through. So you take your syringe and you're performing your liposuction in, say, the inner thigh, and you're not really changing the shape of the inner thigh because you're not taking that much fat. You're just really doing it just to gain the fat.
The cannula, which is a little tube that we use, like you use for doing it on the body, which this is probably less than half that size.
Yeah.
And you always see, like when you do liposuction, you don't want to go too superficially, so you don't want to affect the shape. And honestly, a lot of patients jokingly say, "Oh, absolutely, take as much fat as you want from my inner thighs." But in general, you would have to take much more than what you use for the face. You take several syringes, and then once you remove that, you process in that spinner that we talked about.
Right.
And then we'll probably show a picture in one of the other sessions, but you can see what areas of fat, what areas of stem cells, what areas of blood, and you can sort of separate that. And then I further process that. I have these special gauze pads in which I process the fat to allow more of those impurities to come out. So a lot of the more of the fat byproduct